Hello, my name is Kiarra Donnelly, and I am a therapist at the Emily program. Today's Ask Emily question comes from Beth. Beth says, my son is struggling with an eating disorder and a substance use disorder. Which disorder should we treat first? This is a great question, and the answer is somewhat complex because what we know about both eating disorders and substance use disorders is that they can be life-threatening. So the first step is going to be medical assessment to determine if there are safety risks such as withdrawal or the risk of refeeding syndrome. The results of the safety and medical assessment are going to determine if the patient needs to be admitted to an emergency room, maybe a detox center, or whether or not the patient is appropriate to admit to a treatment center at the inpatient, residential, or lower levels of care. Once the patient is medically stable enough to get treatment at a treatment center, the gold standard is going to be that both disorders are treated at the same time. The reason is that often the symptoms and behaviors of both disorders serve the same function. So if both aren't treated at the same time under the care of a treatment team that's looking through the lens of both disorders, then there's often going to be a whack-a-mole effect. While the symptoms and behaviors of one disorder are contained, the others may actually manifest more significantly. So with the help of your care team, it is possible to understand the function of the behavior, learn skills to avoid that behavior, and work through the distress that's underlying that behavior, and ultimately seek long-term recovery from both disorders.